everyone. Welcome to our Volunteering for Seniors virtual interview segment, where we delve into topics that revolve around aspects of health and wellness for our senior community and their loved ones. My name is a.k.a. and I am the head outreach coordinator for VFS, where our mission is to help seniors stay energetic and be active members of the community in any shape or form that allows them to maintain or improve their quality of life. Our volunteers aim to help seniors combat isolation, provide relief, and support members to enhance their quality of life. In order to pursue our goal, our efforts range from friendly house visits, grocery runs, social events, and engaging with various professionals through virtual interviews just like this. So without further ado, I would like to introduce our speaker for today's segment. Today, we have with us Dr. Kiran Dintyala, also known as Dr. Calm. So Dr. Dintyala dedicates his professional practice in internal medicine, functional medicine, and stress management, ultimately aiming to combat and provide relief towards stress-related conditions and sharing measures that allow people to lead a lifestyle with tools to cope with and prevent the hindering effects of stress. Dr. Dintyala earned his medical degree from Andhra Medical College and completed his master's in public health at West Virginia University. From there, Dr. Dintyala completed his residency at Albert Einstein College of Medicine in New York. His pursuit to provide personalized care was further strengthened by his diploma in integrative and holistic medicine and functional medicine knowledge. So today, we have the honor of chatting with Dr. Dintyala to learn more about stress management, its relationship with chronic illnesses and the senior community, tools to overcome it, and more. So welcome, Dr. Dintyala.
Thank you so much, Akila. I appreciate that introduction.
Thank you so much. And thank you for your time today and allowing us to explore and learn more about your work. And so we definitely have so many questions I have so many questions I want to ask and converse with you about. But before we delve into the specific topic, it would be wonderful if you could kind of break down the terms for us that we'll probably keep hearing now and then in our conversation. So my first question to you is, can you kind of delve more into what is functional medicine, internal medicine, and stress management?
Sure. So, internal medicine is a degree that doctors, after 3 years of doing what is called a residency, they get a medical degree after this is after med school, actually. So, post graduation. And internal medicine is one of those degrees that you get. And it essentially gives the doctor the knowledge, skills, expertise to help people with various kinds of problems, starting from as simple as sore throat, cough and cold, to as severe as a heart attack or a stroke, or someone is in ICU on a ventilator. So internal medicine is that field of medicine where there's a wide, there's a width and breadth to reach so many things and treat so many conditions. And I'm very, very happy to say that I was able to do, my residency and get this degree. That helps me a lot in seeing patients. Now, the second thing I think you asked is about the functional medicine. Functional medicine is a relatively newer field. Maybe in the past 10 to 15 years, we have been hearing more about it. It is about diving deep into a patient's problem, condition, and trying to solve it by addressing the root cause, and that too with evidence-based research and guidelines. Internal medicine and our modern medicine is phenomenal, and we can do so many things. But yet, there are certain conditions that are like, what do I do with this now? If I have hypertension, if I have diabetes, yes, I do take pills, and that is going to help me. I do maybe exercise and that is going to help me. I do follow some diet, it's going to help me. But is there something else that I can do, something different that would maybe even reverse hypertension or diabetes or reduce your dependency on the medications? Are there lifestyle changes beyond what is normally taught, what is normally known for most people? Are there things that you can do that will greatly enhance your health? So that is the functional medicine aspect. And there also comes the lifestyle, cutting down the stress and many other important factors. Now, I think your third point was about what is stress management and why am I doing that? Well, I noticed early on in my career, that was almost 15 years ago, after I was done with my residency, doing my job, my first job, like I was very proud of what I learned. But within a year or two, I realized, oh God, we take care of the physical problems, but the mental health issues are so big. The stress that people face in their lives is tremendous these days. And I noticed stress can lead to many illnesses. It is linked to the five leading causes of death, including heart attack, cancer. It is associated with accidents, addictions, so many other problems. And I said, I got to do something about it. And that is when, I started integrating what I learned during my master's in public health, where I took courses on stress management, resiliency, and finding that inner happiness, which was very helpful personally to me. And I thought, I'm going to share that with my patients and other people. So I do see stress management as an integral part of healthy living.
Yeah. No, that's great. Thank you. That's an amazing explanation. I think what you what I got out of that is, it's important. I think even with functional medicine, it's the idea of enhancing quality of life that you mentioned. And I think preventative care is, I mean, you can definitely talk more about this. Do you think that stress management is something that kind of, how do you think this interplays with functional medicine, and what tools from, your experiences and your, expertise do you see that it's kind of caused preventative care to be something a little bit more emphasis on that you've seen, and
Yes,
how
so how does the stress management affect our health? Stress affects our health, and what can you do to manage? And how does it integrate with, the functional medicine modalities or other things? Is that what your question is?
exactly, because we see that there's always some correlation, but like in, I think what we tend to see is what you were mentioning, how, those top five chronic illnesses we see tend to kind of get rooted because of
Yeah,
stress.
yeah,
Um, and we tend to see some causality, but we don't realize, like, oh, it's kind of like a feedback loop in a sense. So
yes.
where do we start, right? And so can you talk more about,
Sure.
how they contribute to the overall
Yeah,
well-being of life, things like that?
absolutely. And especially, I think caregivers uh, who are going to watch this video, they have so much stress in their lives, and often they are either middle-aged or senior citizens trying to care for someone else. And in that process, they get burnt out. The statistics are pretty alarming, anywhere from, depending on which statistic you look at, and it's really like 30 to 40% a minimum, are very stressed out. Probably it is more. I think the numbers are underestimating it. And the caregiver is also put in a situation where it's almost like no choice, like they got to take care of it, and yet they are not necessarily taught how to handle stress or how to handle many of the issues in caregiving. Actually, they are learning along, while caring for. So I think they will greatly benefit understanding about stress and how it integrates with their health. So um, And coming to the first point about stress itself, how it affects our health, it is proven, if you look at all the research, 80% of chronic illnesses are rooted in chronic stress. I see all the time in my patients when they're chronically stressed, and the difference between acute stress and chronic stress, as people might already know, is that acute stress is something that is short-lived. It comes and goes. Something happened, and maybe in a half a day or a few hours, it's kind of gone and you're done. But often people have this chronic stress because of, for example, again, caregiver situation. Every day they have to go in and do that, whatever that they have to do. And there are stresses of life that take a toll on them. So that stress becomes chronic every single day for months to years. So that is a chronic stress. And when people have chronic stress, there's one research study done by Harvard, and it was published in a famous journal, I think Lancet journal, which is very well known as in the scientific community, that they followed all these patients with chronic stress, and they noticed that it promotes what is called atherosclerosis, means the plaque formation in the arteries in your body. And one of them, you know, the arteries, coronary arteries, means in your heart. And then when you have plaque formation there, that is what leads to heart attacks. And the same thing in your brain can lead to strokes. Okay. So that is very clearly shown. And also atherosclerosis, for example, when they have it, it increases the risk of having high blood pressure. So it's very clear. It's called cardiovascular disease as a whole, what we call it. And I have also seen and research proven that chronic stress leads to immunity problems. Either your immunity is low, means degraded when you are stressed out, making you susceptible for infections, whether it is COVID, like most recently, how, or it could be a bacterial infection, it could be viral, other viral infections, whatever it is. So when people are under stress, their immunity is not functioning at the best. Hmm? And some people tend to develop autoimmune diseases like rheumatoid arthritis, lupus, a variety of skin conditions, so many other, because your immunity again is kind of, off. Can't figure out what to do exactly. So it's confused and is attacking our own body. That is what is autoimmunity is all about. So it is associated with that. I have so many patients who I see who are stressed out and they have these migraines and headaches. And headaches, as you know, a big problem. So many people have headaches, and I'm saying not everything is just because of stress, but stress is an important factor that brings it upon or exacerbates it, makes it worse. And that is another big thing. People who are chronically stressed, again, they have a higher risk of having diabetes. And if they already have diabetes, their diabetes is out of control because stress releases a hormone called cortisol. And also, the cortisol makes your blood sugars difficult to be controlled. And then if you talk about hypertension, with high blood pressure, stress releases norepinephrine. It's what we call as a vasoconstrictor in medical terminology, means just take the blood vessels, constrict, means get it tighter, narrower, and then that leads to high blood pressure. So they can suddenly shoot up their blood pressure, and they're all controlled very well so far with all my medications, and then all of a sudden it's like 200 by 120, and I ask them what's going on, and they say, there is so much stress in my life. Something happened yesterday. Something happened last week. I'm dealing with this. And all of a sudden, I have this chest pain, I have this headache, I have this blood pressure going out of control. So all the time I see that. Um, Stress can also lead to uh, seizures like epilepsy because it makes your neuronal cells irritable. And so if you have a predisposition for having seizures or epilepsy, it makes it more possible for you to have it. And people who are stressed also have insomnia. They can't sleep well at night. And people who are stressed also do emotional eating, which can lead to obesity, metabolic syndrome. So if I, this whole conversation could be about just the ill effects of stress, and I can talk about it for 2 days nonstop. So many problems. The point really for people who are watching this to know is stress is not simply a psychological problem. Oh, I'm just worried. I'm just anxious. I have a little, fear. I mean, that's okay. It's not that. That is one aspect of it. That is the tip of the iceberg. Underneath, it is eating up your body. So it is very important that people pay attention to the stresses of the life and then take constructive steps to prevent it, to resolve it.
Yeah. No, that's beautifully said. I think out of the spiel you gave about, how uh the direct effects that stress can have physiologically makes it even more, urgent, and I think encouraging for others to hear, like, okay, then how do we cope with that? It's not something to neglect and just think it's a temporary thing. It's like now you see that this can just kind of slowly creep into our lives without even real.
Yes.
And it's like, how do you now? I think it's a great segue to kind of understand how can we find ways to implement different, techniques or ways to be cognizant of that while we go about our daily things. And yeah, sorry, go ahead before I go on.
No, that's good. That's good. I think that's a nice segue, actually, moving into how do you manage stress, So knowing now all these bad effects
Yeah.
of stress. I call stress is a silent killer.
Mm.
COVID killed lots of people kind of a sudden, like in within a few weeks to months, but stress is something that is, like silently, slowly, like slow poison is killing you and leading to many diseases that you're like, why am I having this all of a sudden? Like, yeah, what did you do all these years having, you know, all the stressors in your life and that is affecting you now? So, yeah. So now coming to, so what can we do about it? That is probably the single most important question in this interview. Before we actually dive into what can you do about it, a very, very, very important thing is for people to know what actually stress is. Because if you do not know the problem, and if you do not know where stress actually comes from in your life, you can't solve it. Like I say, um, you can't fight an invisible enemy.
Yeah.
You
That's
need
right.
to bring the enemy out of hiding and then kill the enemy.
Mhm.
The same thing with stress. Now, uh, I define stress as simply a state of mind where you are unhappy and miserable. It doesn't matter the reason. A state of mind where you're unhappy and miserable. Either it could be something happening outside, for example, in this caregiver situation, they had to daily deal with whatever that is happening around them and go do this, and they don't have time for themselves to relax. And so these external factors definitely put pressure on them and eventually, stresses them out. And that is one thing. But also at the same time, stress can also be internally generated, means people thinking about stuff. what happened yesterday, or what happened a week ago. Your boss said something, or something else that happened. Uh, and it was over the event, but we do not let it go. We carry it forward with us in our minds. We continue. It is okay, a day or two, everyone is going to be affected by what happened. But when you carry it forward every single day, every single week, every single month, then you are creating that chronic stress in your mind. Um, Sometimes it may not be something to do with the past, your future pacing and thinking, oh, what is going to happen a week from now, or 10 days from now, a month from now. Sometimes people think, what is going to happen 10 years from now? And they get worried about it now. But future is just a figment of your imagination. Even what is going to happen 5 minutes from now, I don't know what's going to happen. Something might happen, and there's a technical difficulty, and this interview might end. I don't know. It might continue, right? One patient can come in suddenly and saying that there's an emergency, I got it, and anything would happen 5 minutes from now. We try to predict, we try to project to the best of our knowledge, but it's not always accurate. Then why project negativity into the future? Because the more you project negativity, the more you're going to invite it, right? And the more you're going to worry now. And that might never happen, but you're worrying about it all this time, sometimes for months to years. So, future is a figment of imagination, leave it alone. Past is a memory. It doesn't exist anywhere except in your mind. It's gone, it's done. So, don't keep bringing it into your present and worry about it. So, anyway, the reason why I'm mentioning that is internally, people generate lots of stress apart from valid external factors. So, and the more we can gain control over those internal factors, the less we will be stressed. Anyway, we have to deal with those external situations. Let us deal with them, but don't add to it.
I was just gonna add, you just said it. I sometimes like I'm guilty of feeling that a good, even actually in my own personal things right now, like dealing with my professional career development and things like that, it's so easy to think about the what ifs. And I have to like, um, what does help is kind of coming back and, remembering I can't control that. It's what I can control is my actions now, and that the result will happen later. Like I can't control what's going to happen, but what I can control is the present. And I think you've said that beautifully. There's so many ways or opportunities for us to ruminate about things. So um it's being able to recognize that you're over like thinking about certain things and then coming back and you know telling that to yourself and then going back on track of okay, let's just be in the present moment because that's again the only thing that we can control. Everything else is not in our ability to
It's not in your ability to control, nor it is real.
mhm,
That's the point. There
mhm,
is real only one moment. This moment, that is real.
mhm.
Everything else is just in your mind.
Yeah.
Just a very simple example. Take a breath, take a deep breath. Can you breathe out at the same time?
No.
Breathe out slowly now. Can you breathe in at the same time? No. Life is breath to breath, moment to moment. Whatever that is happening now, that's the only thing that is real. Our minds tend to pull us this way, this way. The more you remember this is happening now, this is what it is, nothing else, then you tend to worry less. And even when you have like difficult challenges, for example, the caregivers trying to do all those things, if you are present as much as you can and not to be taken over by those thoughts that try to pull you in all those directions, will help you. Even the present stress, what you actually that is happening, you'll be more efficient in doing it. Because when your mind is distracted, worried about this, that, you can't focus on what you need to do. You become less efficient. Often these caregivers might have a job that they need to do and then come and then take care of whoever, their loved one. And if they're constantly worried, then at their job, they will be less efficient likely, and they'll be wasting time or tired because of all the worry. And by the time they come to take care of their loved one, they're already so much stressed. And then now adding more to it. However, if just imagine a different scenario, they have the tools to cut off all that unnecessary stress and be happy, cheerful, present most of the day. Then, when they come to take care of their loved ones, there is a higher chance that they will be like, okay, I can do it. Let's do it. Yeah, I know it's not easy, but I have the energy to do it. So I say it is not so much about what is happening outside, but it's actually what is happening inside that determines truly, are we happy or not? Are we stressed or not? And this is not to discount the external challenges that we have. We all will have those challenges that we got to deal with. There is no doubt about it. For caregivers, a certain kind of stress. For doctors burnout rate is high, as you know. 40 to 50% of doctors are burnt out. They have different kind of stress. IT professionals have different kind of reasons for stress. A student has different reasons for stress, like yourself thinking about your career, what to do this, what to do that. So no matter what is the reason, what I say is, if you can master the art of calmness, being calm in the midst of chaos, because chaos is always going to be there.
Yeah,
That is the nature of this world. But
definitely.
if you master the art of calmness, then you can manage the chaos very well. You can see order in the chaos very well. Then you will be like more efficient, multitasking, this, that, and all that. And like, yeah, you'll suddenly become a Superman or a Wonder Woman.
Mm-hmm. No, that's so true. And I know you're going to bring up I think it's so important to find ways to implement these techniques to kind of reduce that internal cause of stress.
Yeah.
But before we get to, your advice on that, actually, Dr. Dintyala, do you mind also kind of, in your own experience and your practice, what do you think, or what have you perceived to be kind of the unique stressors that seniors tend to face compared to other age groups? I know we've definitely delved into, I think it's as important to recognize the caregivers and,
Yeah. But in
that,
general, seniors, we're talking
yeah, like,
about.
and because I think we've talked about how stress can correlate or kind of strengthen or extrapolate exacerbate the physical effects that they might have that people
Yeah.
are physically. But how about people like, for example, seniors when aging occurs and they might have already hypertension and arthritis and things because of just the physical aging. And what have you seen that are kind of uniquely set or seen that stress caters towards or stress focuses on seniors? Like
Yeah.
how is
What kind of stressors the seniors have
right?
and what can they do about it?
Mm-hmm.
So, they do have a different set of challenges. Right now, young people, you're typically healthy and, yeah, you may have problem here and there, but you're not combating with chronic illnesses typically. Some are, but not typically. But as people age and when they get to that age group of 65, not all, but many tend to have arthritis, and that leads to pain, or their hypertension or diabetes, or they may have had a heart attack and they have to do something about it. And so illnesses tend to happen more as you grow older. And that, I think, itself is a big stress for them, especially in the healthcare system that we live in. They need to get an appointment. They can't get an appointment for a month or two. They want this medication, and then the insurance says that we don't pay for it. You have to pay out of pocket X amount of money. And sometimes doctor visits are short. They went there to, get all their answers. But the kind of system that we live in, there's specific 15, 20 minutes time allotted, and then they may not be able to get, and then they had to wait now for another 2 months. So there are so many things from a health perspective why they can be stressed just being in this healthcare system that we live in. We need to acknowledge that for sure. And the chronic pain is a big thing. And people also tend to develop depression in the older age group because, all these illnesses take a toll on them, and then the socializing may not be that easy. They feel isolated, and isolation is a very big problem. And they feel like no one wants them, the loneliness. All these things I do see affect seniors. And sometimes when they are retired, they kind of they feel like they lost their purpose in life. Like, what do I do now? I'm sitting at home and everyone's at work, and I don't have a social circle. Or when they move from one place to another because of retirement, they don't have their old friends that they are used to. So all these different things can affect them.
Yeah, definitely. And I think then that brings us back to what do you like brings us back to the topic of conversation we were having before, even with caregivers. Um, what do you think, or what have you seen in your practice or experience that have been found to be successful, or ways to manage those stresses that you've talked about? What are some things that um, you can share that maybe they can like kind of implement in their daily lives to try to find a way to kind of provide relief in that stress that they might be having?
Yeah. So if someone is retired, for example,
Yeah.
let's take that a senior who is retired freshly, and then all of a sudden, like, what do I do now kind of thing. They may be happy for a month or two that they don't have to work.
Mm.
But after that, the reality sets in, like, you can go on vacation only for so long. You can do nothing for only for so long. And after that, so one of the things is having a routine, morning to evening, you know, some routine, whatever that works for you. Finding places around where there are activities for seniors. Volunteering gives them a purpose, and they help other people. And when you help other people, it releases a hormone called oxytocin. Like when you hug others, it releases a hormone called oxytocin. The same way when you're helping others, serving others, oxytocin, that is a love hormone that makes you feel good. And the other thing that they can do is exercise is a very important aspect. Some kind of strength training. It doesn't have to be like 100 pounds, lifting. It could be simple, 15, 20, 30, 40, whatever that you can. But the strength training keeps your muscle mass intact because as people age, they tend to lose the muscle mass. And that happens more in seniors. So inactivity is not good. And when they lose the muscle mass, then they become weaker, that increase the risk of falls. And also there is increased risk of osteoporosis and fractures in the elderly population. And by doing these things like exercise, strength training, activities, they strengthen their bones also, reduce the chance of, fractures when your muscles and your bones are stronger. Along with this, learning some coping skills for stress, which we'll share with them later, what to do when you're stressed, how can you prevent that? And having a good social network. We are social beings. We have awakened to that reality very, very clearly during COVID. where like, oh God, like I remember like when COVID hit, it's March, April, around that time, 2020, I think, when I went to work, none of my colleagues were there. Everyone is hiding somewhere. No one wants to see anyone. And then we were used to sitting in one big doctor's lounge and the doctor's room, chart, talk to each other, joke around, and and then work together. And all of a sudden, I was just alone in that room. Someone else is somewhere else, and no one wants to see anyone else. And I'm like, this is very depressing.
Yeah.
I realized that, oh God, I didn't know that I was such a social being.
Yeah.
So being social and going out and meeting friends and making those things proactively happen proactively will help them a lot.
Definitely. Um, and it kind of brings me to another question of what about seniors, or people that you see maybe they don't have that social network or they don't have that um company to lean on. Have you
Oh,
ever, like what do you think a physician's role could be in that type of situation? I think a physician and a patient is another kind of camaraderie or
it's
relationship.
important partnership. Yeah.
It's,
Yeah.
seeing that you're able to understand that they're having these stressors and seeing how it physiologically is affecting them. If someone were to bring up maybe barriers to care. And one that you've mentioned, that's a big one that we also in VFS kind of strive to provide relief in is isolation. How would, someone go about that? And are there resources that, even like the medical field can provide in that sort of situation? Or have you seen these things occur?
You know, something that comes to mind as you're saying this, the isolation and no one around. This all comes down from the breakdown of the family structure that we used to have 50, 60, 70 years ago, intact family structure. And because that was their social support system automatically built in.
Mhm.
And because nowadays that family structure is definitely broken without any doubt for various reasons. It's not necessarily one person's fault or anything like that. We want to go out, work somewhere else, and so now we are far from our parents and we settle down um, hundreds of miles away. And then our parents need our help, and then we are stuck in our jobs and we can't go there for more than a few days, and yet they have to handle it all by themselves. That is one thing. The second thing is even when there are families with their children around, the children have their own life. They are busy morning to evening in their jobs, and then so the lack of availability.
Yeah.
That is another big thing. All these things lead to what are the things that we can do to promote their wellness, well-being without getting isolated. There are multiple volunteer organizations around for seniors, and I believe having a list of them available at a physician's office or any other office, where they regular and giving them those resources can be helpful. And for those people who are kind of a little hesitant, hey,
Mhm.
I don't know if I should go or stay, or I know the new people, I'm shy, or whatever it is. Some facilitation might help, if you have an assistant or if you have a social worker, and they can make some phone calls and set them up with some organization that they believe that it is really good. But there are things around. If where there is a will, there is a way.
Mhm.
And often people have inertia
Mhm.
in doing things like, I don't know. So
Yeah.
they need to overcome that. And the world, I mean, especially the United States has so many resources compared to the rest of the world in general. And there is always a spiritual organization, your church or some other spiritual organization where you can go be part of and say, "Hey, I just want to volunteer. I just want to help out. What can I do?"
Yeah, definitely. And I feel like I feel like we've seen improvements. I can definitely see that, it's amazing to see how many volunteering organizations are there that have those niche goals in mind. And um, I think it's like a great place that a physician has to be kind of the mediator between the two, kind of getting these conversations with their patients and being able to direct them to places that can kind of,
Yeah,
specifically cater towards those needs. I think it's super important. And
yeah,
you mentioned, the resistance part of it, the hesitancy, um, that patients might have, or seniors might have, or caregivers might have of how do I express this if I myself can't catch that, or I can't even realize that I'm feeling this way, or not able to kind of pinpoint what is making me unhappy, what is making me
yeah,
miserable. Um, what do you think, what are some, before we even bring to coping mechanisms, I think it's like, how do you how do you recommend or find like how do you encourage people to kind of think about how does stresses affect me before they come to the physician's office? What do you think are, you know,
yeah.
conversations?
Self-awareness.
Yeah. Mm-hmm.
Self-awareness is very, very important.
Yeah.
Um, a lot of people, they're not aware
Mm-hmm.
what is happening. Like mind is so restless, lots of things. Like, they can't put things together. This is the reason, oh, that's the reason it happened. This is the reason, oh, this is the reason it's happened. So they can't put that together. And so I believe being in touch with your mind and body and being aware of what it's telling me, what should I do? That kind of self-awareness is very, very important. But you can be self-aware unless you're calm, because a restless mind masks all those internal signals that your body and mind are telling you. Like you're too distracted in your head. Again, this comes back to why calmness is so important and how it actually improves your self-awareness.
Yeah, definitely. I think it's like, I think it's the idea of um sometimes people just don't know what to ask sometimes. Like they don't even know where to start of the questions. Like, you know, um, you can think about this in just physical health as well, is there's so much overwhelming resources out there for people. And I think it's important to kind of find a way to dilute it enough so it can kind of provide a good relate like conversation between a patient and physicians. Like even in my own personal work, I kind of tend to see patients just don't know what to ask in the first place. They just kind
Yeah,
of go in and they're like, it's too much information. I don't, that's why then their first automatic response is, I'm just going to trust everything on the doctor. And if they have a good relationship, that's amazing to have that relationship, to have full trust. But
yeah,
sometimes, they don't know anything about their health status, or,
yeah.
and maybe that could also be a cause of stress for them as well, and so
I'm
I,
sure that is a big cause, and I think you brought up a very important point. Unfortunately, we have built a healthcare system where there is no proper health education. Means even educated people normally regarding their health, they may not be educated enough because number one, the resources are there, but not in their reach. Number two, the resources are there, but there's so much information out there. You have this influencer saying something, and you have Google saying something, and then someone on YouTube saying something else, and then you're like, what is true? The information overload and confusion that we have right now is like never before.
and like, how is it even relevant to your
To
specific?
me, like I have seen people like typing in, I have a little redness on my skin. And then they typed in Google, Okay, streptococcus. Google answers. Oh, you may have an infection with streptococcus and they may have to take off your hand or leg, or you might die. Like, what are you talking about? No, it's just a simple cellulitis at all. And you just need a small antibiotic that will relieve, that cellulitis in a few days. But you don't know how to put it in context. You just have information, but not intelligent information that is relevant to you. And that is where I believe this patient-doctor relationship becomes very, very, very important. As a doctor, I know what is dangerous, what is not, what is that you have to worry about, what you don't have to worry about. But as a patient, as a layperson, they do not know. So they worry about lots of things and they don't know where to go.
Yeah.
And it is good to have that information on Google and all that, but at the same time, people need to realize that it's not their doctor. And there is part of the blame can be imparted to doctors too, or the healthcare system too, where the doctors could not give enough time and attention to the patients as much as they want. They want to. But the system, the insurance, and everything that the way is built is you got to see so many patients each day. And so the doctor is trying to meet. I have all these patients scheduled. I have to see them. So I have to finish quick, whatever I have, so that I can see the next one. This one is not necessarily totally happy because they are not all the questions answered. So that's the system that we created. And we need to break that system. And that's the reason I broke out of that system and I practice what is called concierge medicine, where people, like patients, when they come, I spend an hour with them. So total attention,
Yeah.
what they need, every single problem, and counseling them about lifestyle, educating them, coaching them, holding their hand, giving them medication, whatever that is needed, so that you can get the results what you need.
Yeah.
That's the direction we need to move. And doctor should become a friend of the patient like it used to be some 100 years ago. Doctors used to be friends. Actually, if you look at the etymology of the term doctor, doctor equals friend. Doctor equals teacher. Doctor equals educator. If you go back to the root words.
Right.
Yeah.
It's a little humorous how it's I think it's, as you mentioned, it's something that, you can't really pinpoint on something to blame about how it diverged from that. But it's more just like the service became a little bit of an industry at some point in time where it's something that the service now has to kind of has to have this relationship with the other parts of what makes something, a business, which is the billing, the insurance, like the
Healthcare has become a business, and I think that is the biggest crime, in my opinion,
yeah,
because the way it is set up to generate revenue, make more profits for insurance companies or big organizations and all that. And there is nothing wrong in making money or running a business. There's nothing wrong. But when that has essentially cannibalized everything else, and that is the bottom line, you know, then the patient care takes a hit, suffers.
that patient physician relationship that would
Yeah,
they could have relieved stress sometimes not
yes,
be an answer.
yes, yes. And that needs to change. There is no doubt about it. That needs to change, absolutely.
Yeah. And I think, I hope the people who watch this as well have a good relationship with their doctor and physician, and because that's something that would be an amazing asset to have to kind of find a navigation to provide relief. But kind of one of my closing questions for you, actually, Dr. Dintyala, is I know we've kind of touched upon it throughout our conversation, but um, what are some actions or strategies that seniors, caregivers in this like demographic, what can they actively do to manage their stress? Can you any tips on like coping mechanisms or things they can take out of this video today to implement in their daily life? And
Yeah,
what do you
yeah, yeah. Apart from the fact that for everyone, there are external situations,
Mhm.
that determine the stress and which they have to use their intelligence and common sense to see how to best deal with those situations. That is definitely important. There is no doubt about it. But a lot of it is really how you're controlling your internal environment. Because the moment you say stress is coming from out there, you lose control. You feel helpless. You become upset. You become angry. Yes, there is no need to diminish the role of the external factors. Yes, they are there. But do not impart your entire reason for stress is that. It is also your reaction, your processing of that information, how you're responding to it, and what you're doing.
Yeah.
At least have a 50% role conservatively, but in my experience, has 80 to 90% role. Because I have seen people with similar situations, but the one who is actually, developed those good coping mechanisms have handled them very well. Yes, they are still a little stressed and all that, but they handle them very well. The overall outlook is like, yeah, that's okay. I live with it. I know what to do. Versus same situation, another person who were not equipped with these coping mechanisms, like, oh my God, I don't feel like living. I'm depressed. I want to die. I can't do this anymore. You see. And I think our role should be, and my role as a physician should be to transition them from that state of, oh, I can't do anything about it, versus here are all the things that you can do, where now you have the tools to fight. Now you have the tools to cope. Now you have tools to prevent problems as much as you can. So that's the thing. And for that, now coming to more specifically, what can you do about it? What is that coping mechanism? So I created what is called the PET system, a three-step system. P stands for three principles, E stands for two relaxation exercises, and T stands for one calming technique. And when people practice that, what I say, 15 to 20 minutes a day, if you practice it, you can keep 80 to 90% of stress away. Like you brush your teeth every day. What happens if you don't brush your teeth for 3 days? Obviously, it's going to be foul smelling. You can't even think about it, right? But now, have you brushed your mind in 70 years? No, means what I mean to say is like our teeth needs to be brushed the same way our minds need to be brushed off all the plaque of negative emotions, negative thoughts accumulating from years and years that need to be brushed off regularly every day. Empty the negativity so you can sleep well. When you wake up in the morning, feels good. Fresh day, better day. So the system, when they follow it, 15 to 20 minutes a day, there is an audio that they can listen to that will help them. There is a relaxation exercise that they can practice. There is a calming technique that they can integrate into their life. And when they do that every day consistently, like they brush their teeth, then they will be happy. Stress runs far away from them. They'll feel calm, peaceful, more joyful.
That's great. Yeah, no, I was just say like I think you've told me like the overarching theme is being able to recognize what you can control and what you can't. And the ones you can control, that's something not even worrying about, but acknowledging and then dismissing everything else because it's not whatever you do now is not going to affect that. It's just focus on today and focus on the present moment and go from there. I think that's honestly a big tenet. I think that could, you
And
can.
there are tools for that. Like I said, I mentioned this PED system and actually created a whole course called the happiness therapy.
Mm.
It's almost like 3 hours, 30 minutes video content divided into modules. Like, how can you come out of despair? And see, people feel like, everything is dark around them. They feel like so depressed and then like hopeless. How can you come out of it? How can you find that happiness again in your life? How can you become resilient, gain more strength, mental strength, spiritual strength, and this entire system, what I mentioned. So I put everything together into this course that people can follow because I am not there all the time because not every patient I can see. So I put everything into this course so that they can access it and they can learn and watch it.
That's wonderful. Yeah.
If they want to know about it, they can email
Mhm.
us at stressfreerevolution@gmail.com, or they can also email at info@stressfreerevolution.com.
Perfect. Yes. And I'll also add that in the description below on this webinar as well.
Absolutely.
Yeah.
And they can go to my website also, stressfreerevolution.com. They can go to Amazon and find my book, Calm in the Midst of Chaos. It doesn't cost more than $10-15. They can read so much information. What I'm explaining is in there. So, yeah, there are many resources available.
Wonderful. Thank you so much, Dr. Dintyala. Do you have any other last thoughts that I wasn't able to ask you if you want to add anything?
I think that is pretty much. If anyone just needs help, ask them to reach out and I'm here to help.
Perfect. Alrighty. Well, thank you so much for your insight today and sharing your work and your passions toward the community. And I think, engaging in these type of digestible conversations like this is really important. And, sharing resources that you just did as well is really valuable for seniors in the community and just in general. As we talked about today, there's such a vast amount of knowledge out there. And I think it's roles like volunteering organizations and physicians and these service professionals to be able to kind of find a way to cater towards our specific communities. So I just wanted to end this session again by again thanking you, Dr. Dintyala, and to join our cause in connecting the community with free resources and just resources in general to promote aging with independence and agency and increasing community awareness of the many determinants of health that the senior community face. And we hope to share any other resources that Dr. Dintyala mentioned, which he did, and that we might be able to provide on our website as well. So, and if anyone else has any questions, as Dr. Dintyala just mentioned, we'll provide the emails in the description below this video as well. So thank you so much for this conversation.
You're welcome. Thanks, Akhil. Appreciate your time.